Hello and welcome. You're watching Coronavirus Facts vs. Myths. I'm Rishika Barua. Top focus. Well, a study on mixing Covishield and Covaxin has been approved by the Drug Controller General of India. The study and the clinical trials will be conducted by Vellore's Christian Medical College, and this study will be different from the one that was already conducted by the ICMR. And the ICMR study, remember, said that actually mixing these two COVID vaccines elicited a better safety and immunogenicity response. Let's get in a first reaction from Dr. Lancelot Pinto, consultant pulmonologist and epidemiologist from the Hinduja Hospital, joining us. Thanks very much for being with us. Your first reaction to this very interesting approval from the drug controller to mix these two COVID-19 vaccines that are available in India. How does this really work and how will it impact our fight against COVID?
Hi Rishika, thanks for inviting me on the show. I think this concept of a heterologous prime boost strategy, where you have two different vaccines acting on two different targets given sequentially, has been used in other diseases, and there is reason to believe that this might generate a stronger immune response simply because you're targeting different parts of the virus. So we know that both these vaccines have different strategies. One is an adenovirus vector vaccine, the other is a whole virus inactivated vaccine, and a combination of the two may eventually result in much more robust responses, but that has to be subjected to a trial, and a trial is a step in the right direction.
Right. I want to understand from you though, Dr. Pinto, we're putting out a list of countries where vaccine mixing is happening, and a majority of these countries are actually mixing vaccines because of that initial hesitancy with AstraZeneca. So it's essentially AstraZeneca clubbed with an mRNA vaccine. But what we are seeing here is an adenovirus vaccine going to be mixed with a viral vector vaccine. How does the technology make a difference?
So you're right. I mean, this combination of Astra followed by the mRNA vaccines actually happened when there was this whole concern about clots, and a lot of individuals had already received the first dose with the Astra vaccine and therefore had no other option but to receive the mRNA vaccine when guidelines did not allow the under 55, if I remember right, to continue having the Astra vaccine. But that was a natural experiment which happened as a result of this realization that one caused problems of blood clots. Now, that being said, that again resulted in a more robust response is what we found. There were more incidences of immediate adverse effects like pain, fever, etc. tended to be more in that particular strategy in the immediate response. But in terms of the overall response, I think it gave excellent results as well. Now, I agree this is not an mRNA vaccine which is being tested in a combination. But again, my understanding is that the pathways through which both these vaccines work are different.
Right.
Which is why even when you look at the studies, the response rates, the antibody responses to both the vaccines have been different. The efficacy has been different. And mixing the two might result in generation of antibodies that target different parts of the viral vector.
I want to very quickly, before we move on, ask you one more question about vaccine mixing, because initially when Spain had started vaccine mixing, there was a study that was released which said that you could potentially have higher side effects by mixing two coronavirus vaccines. Is that really what the purpose of this study is also going to look at, whether the side effects are enhanced or reduced by mixing two different vaccines?
No, absolutely. I mean, that's the idea of doing a trial always. What might hypothetically seem to be very exciting, very novel, very promising may not necessarily deliver to the same extent in a trial, which is why it's very important to conduct a proper randomized clinical trial. When you look at what exactly happens. The natural experiment that I just alluded to, it did result in more immediate adverse effects, but fortunately nothing happened long-term, or we aren't aware of any long-term adverse reactions to mixing of vaccines in that situation. But this is a step in the right direction. I think, unless we conduct the trial, we won't really know the answer.
Well, a step in the right direction, and very interesting indeed to see what happens if you mix Covishield and Covaxin. We know there were cases of that accidentally happening, but this, of course, is a concerted clinical trial that's going to happen in Vellore. Do stay on with us, because the other big story that we're tracking on the show today, well, COVID-19 cases in India have been below the 39,000 mark now for 5 straight days. Active cases are seeing an all-time low, lowest in 100 days. Yesterday we saw COVID-19 cases were in fact below the 30,000 mark for the first time in over 150 days. Now this is all happening despite the Delta variant and despite lifting COVID-19 restrictions across most parts of the country. However, there is a red flag and a big red flag. The question here is India testing enough? India, remember, had set a target, the government had set a target of testing 45 lakh people on a daily basis by the end of June. But well into August, those are our testing numbers. It's way below the target. We're testing on an average of around 17 lakh people, and this is the last 7-day average. In fact, if you look at how much we were testing a month ago, it's even lower. So tests have actually further dipped by in comparison to what we were testing a month ago. But the government has now cautioned that despite these low number of cases, states where the R factor is rising are now likely to see an increasing number of cases. So the government has essentially put out a list of states where the R is 1 or above 1, and the government has categorized these states to say that these are states potentially that could see an increase in COVID-19 cases. But is the overall India picture stable in a certain sense because of a dip in testing? That's the question that we're asking. And I want to go across. So we also have Dr. Romil Tikku, Director Internal Medicine, Max Healthcare, and Dr. Pinto also continues to be live with us. Dr. Pinto, first to you, how are you looking at these numbers? You know, many would say that there has been a sort of stagnation in terms of the COVID-19 numbers ranging roughly between 30,000 to 40,000 on a daily basis. And many had actually anticipated that by now our cases would have started to rise. So what explains this?
So to begin with, I think it's a great move forward to direct policy based on what you're actually seeing. So if you're seeing the R number rising in a certain place, to direct all your efforts at that particular place is a great move. So there is no one India, there is no one generalized picture. You look at individual cohorts and individual places where transmission is actually happening and direct your policy accordingly. Now, in terms of the total number of testing, I think that always needs to be taken into the context of your test positivity rate. So if there aren't enough people having fevers, for example, if there aren't enough people having symptoms, you wouldn't as a routine test these individuals, and your testing could be low just by virtue of the fact that too many people aren't having symptoms.
Okay.
The way you know that you are testing enough or not is looking at your test positivity rate. If your test positivity rate is really high, then clearly you're not testing enough. You need to test a lot more to pick up a lot more transmission in the community. So I think that's one of the points that we need to always take into context. The second question about, despite Delta being around, why are we facing lower cases? I think we need to remember that the Delta surge was pretty much what drove our second wave, as opposed to what's happening in the US now or the UK, which were naive to the Delta variant. They hadn't experienced the Delta variant yet. So it is possible that some of the dip in cases is happening because we have some degree of immunity to this Delta variant. That being said, constant surveillance needs to be in place to make sure that reinfections don't start happening, that vaccine breakthrough infections don't start happening. And I think surveillance is the key.
Dr. Tikku, which way would you weigh in? And, we're putting out this information on our screens right now. It's important information because this is what the government is forecasting based on the R factor. Where is the where COVID cases are stable, where they are rising and where they are anticipated to rise. But what, according to you, explains the plateau that India is seeing at a time when many had anticipated that our cases would actually begin to rise?
Well, I think that because we've been through a devastating second wave, and that was mostly due to the Delta variant. So a lot of people have been infected already, and there's some sort of immunity which we have. Even the sero surveillance surveys show that. And apart from the fact that post the second wave, we've had an lockdown, and also the vaccination is doing its bit, though we still have a long way to go, but we vaccinated more than 50 crore people already. So one shot also gives you some sort of protection. So everything put together is giving us some sort of immunity. As Dr. Pinto rightly said, we were the first country to go through this Delta variant, and it created havoc over here. And now we're still in the middle of a second wave. It's not over yet. But
Dr.
you can
Pinto,
see second...
Yes. Yes, Dr. Pinto, I want to bring you in, once again on the testing question. And the reason I asked this, and I know you said that people are not getting themselves tested because they're probably well and don't have symptoms, so they don't feel the need to get tested. But the government had set a target of testing over 45 lakh people on a daily basis, and this was a June end target. Well into the middle of August, we're nowhere close to that target. Our average is around 17 lakh tests a day. How important is it for random testing to be done in order to better be able to mitigate the possibility of a future wave?
No, I mean, that point is, of course, well taken. At the end of the day, you want to be one step ahead. You don't want to be reacting. So surveillance, where you look at community transmission in the absence of people coming forward, is always going to play an important role in staying one step ahead of the virus. I'm not sure where this targeted number came from, and what is the math or the science behind it. But if there was a strong rationale behind modeling, for example, which said that we need to do so many tests in order to stay ahead of the virus, we need to do so many tests so that we prevent the next big wave from happening, then yes, of course, we need to ramp up testing then.
Dr. Tikku, are you worried that we're not meeting our own set target, whatever the math behind it was, where the government had said that it anticipates to test at least 45 lakh people on a daily basis, and this was a June end target?
I don't think we need to go to 45 lakhs a day. We're doing enough. In fact, we're doing more than what we were doing prior to the second wave. Even if you look at the last few days, we've been on average for the last 1 week, we've done 17 lakh tests a day. I mean, in May, June, at the peak, we even went to 35 lakhs a day, which is good enough. And even now, with the positivity rate is less than 3% for the last 2 weeks. So we're doing enough. If you look at Delhi, we're testing 70,000 people in a day. And what are you getting? 50, 60 people are positive in a day. So the disease is at its low ebb right now. That's the fact of the matter. A lot of people have immunity. Testing more is required, but to an extent. And I think we're doing fine over there. We don't have to go overboard. What we should focus on is right now the vaccination, because vaccination is something which will take us through, but we're lagging a little behind, because we're doing about 50 lakh cases a day, but we need to go to 1 crore if we need to vaccinate 100 crore people by the end of the year. And that's where our focus should be right now. Testing is fine, but we are through that phase. Right now the focus is on vaccination and no vaccine hesitancy. More and more vaccines are required. Ramp it up to 1 crore a day. That's the need of the hour, I would say.
Okay.
We have enough evidence now that we have enough protection against Delta also with these vaccines which have been given authorization.
Well, I think that's an important point that you make, that we need to vaccinate more and more people, and we need to do it at a faster pace. Thank you very much for joining us with your perspectives. And I want to sort of just take that and shift our focus to the other big story, because in the United States, almost 50% of their population is double vaccinated. In India, that figure is just over 8%. So if we are to see the kind of cases that the United States is seeing, it could be potentially much more devastating. The US is currently seeing over 1 lakh cases for 3 straight days. In fact, 1.8 lakh cases have been reported in the United States in just the last 24 hours. Cases are up 35% in this last week. Cases and hospitalizations are at a 6-month high. And what's also worrying is that there has been a rise in the number of children who are being hospitalized. Experts are attributing this largely to the Delta variant. Dr. Peter Chin Hong, infectious disease specialist and professor at UCSF, University of California, joins us from San Francisco. In fact, I began by asking him earlier about the spike in cases in the US. Dr. Peter Chin Hong, more than 100,000 daily cases for 3 straight days. How are you looking at this spike?
We're looking at it with a lot of anguish, with a lot of sadness. We all thought that we would have been able to burn our masks by now, move on with life, and now there's a major setback in the US.
And what do you think is causing this setback?
Well, the main roots of all this is, first of all, an unanticipated development with Delta arriving in the US. I think we didn't anticipate that it will upend all of our progress. And by progress, I mean the vaccination rate, of course, which has stalled. And when you think about the main driver of why we've seen such a surge in cases in the US, it's really because of a large proportion of the population, millions and millions of people, despite having vaccines available to them, have not had the opportunity to get immunized.
But close to 50% of the United States is vaccinated, and that is higher than the rate of vaccination in most other countries.
Yes, but that's not enough for Delta. We know that Delta is 1,000 times higher in terms of viral load compared to earlier versions of the virus. And most importantly, when there's high enough prevalence in the community, vaccinated people have just as high a viral load in their noses and mouths compared to unvaccinated persons. So in other words, you can transmit, anybody can transmit virus to somebody who's susceptible. The virus is just looking to continue the chain of transmission. And having 50% full vaccination in the country is definitely not enough to stop a virus that now requires, I think, upwards of 85% in terms of having that force field to stop the chain of transmission. All
right. So you're essentially saying that more than 85% of the population needs to be vaccinated for protection against Delta. That's significant. What about increase in hospitalizations? There are also reports that are coming in of rationing of ICU beds. These are, all too familiar to what India experienced in the second wave of COVID.
Yes, the difference between the pandemic of the past and the pandemic of the future and of the present is that because of the high vaccination rates in the senior population, that is older than 65 and those in a nursing home residents, we have not seen the levels of hospitalizations in general in the country. So what you're seeing is basically two Americas. The America of the unvaccinated. These are states with full vaccination rates in the order of 30% or so, and those states with higher vaccination rates and communities like where I live, Northern California, with 70 to 80% vaccination rates. Very, very different. So in low vaccination rates, we're seeing hospitalizations result in bursting of the seams of ICUs, not having enough ventilators. In communities where there's high vaccination rates, we're seeing an uptick in hospitalizations. For example, in my hospital, we are seeing 8 times the level of admissions for COVID compared to the time of reopening, which was in the middle of June. But nevertheless, the numbers are still very manageable. We can manage with enough workforce. We can manage with enough resources and ventilators the number of people coming in. Very, very different in Arkansas, Mississippi, Louisiana, Florida, Texas.
All right. Well, the numbers and the numbers that we're putting out on our screens just essentially tell the story. States with low level of vaccination seeing a bigger spike, more hospitalizations. Thanks very much, Dr. Peter Chin Hong, for joining us with that update from the US. With that, we're going to slip into a very short break. But up next, Dr. Romel Tikku will be live with us as we take on your questions on the COVID-19 vaccine. Stay with us. Welcome back onto our special campaign, Vaccinate India, in partnership with Google, where we'll discuss questions you may have about the coronavirus vaccines. Dr. Romel Tikku, the Director, Internal Medicine, Max Healthcare, is with us. Dr. Tikku, how do mRNA vaccines work? We understand that this is a relatively newer technology.
Well, mRNA vaccines work like this is genetically engineered mRNA, which is injected inside, which gives instructions to the cells in the body to form the spike protein, which is the main protein of the virus, which in turn kicks off the immunity. The immune cells start making the antibodies. That's how the vaccine works and generates antibodies and gives us protection. This is like, these were the first vaccines which were authorized, mRNA vaccines. Though the technology is old, but these were the first vaccines which have been authorized for use.
Right. One of the reasons why I asked this question is because, it's very interesting that Covishield-Covaxin mixing is going to be studied, because what we've seen happen so far all over the world is that, the AstraZeneca say is mixed with an mRNA vaccine. Does the mRNA vaccine, prove to be a better vaccine when it comes to the booster shot?
Well, there's no recommendation as of now. We don't have enough data, but there have been studies in UK and Spain where they've mixed AstraZeneca vaccine with the Pfizer vaccine, and they've seen that there's a 7-fold increase in the antibodies. So at some point, once we have more data to back it, maybe we'll have some sort of mixing which is authorized. But as of now, there's no recommendation as such.
Right, but does the mRNA vaccine, is it better suited to respond to new and emerging coronavirus variants, given the fact that we know that vaccines may have to be tweaked in the future to respond to emerging variants?
See, as of now, whichever vaccine we're using gives us enough protection against the Delta variant also. In fact, it has an efficacy of more than 90% against severe disease, death, mortality. So all these vaccines, whether it's Covaxin, AstraZeneca, or whether it's the mRNA vaccines, they all give us good efficacy against severe disease and death. And that's what the vaccines are meant for. I don't see any reason for tweaking the vaccines as of now. But in future, in case we do see there's a new variant, new mutation, we can always do that. But presently, all these cover up for severe disease, death, even with Delta variants, and more than 90% efficacy.
Right. As more and more people, Dr. Tikku, get vaccinated, I want to also ask you another question that people are very confused about. Will you test positive for antibodies after you've been vaccinated?
Well, about 10% of people do not show up any antibodies when you test them. It's not recommended. It's not required. Once you are vaccinated, you do get enough protection. Just because your antibodies are low or they are not to some level, it doesn't mean that you're not protected enough.
Okay.
So once you're vaccinated, there's no need to check for antibodies. We only check it if you're not sure whether you've been infected in the past and you need to decide when to take the next dose. Otherwise, there are no recommendations at all. So please don't check your antibodies. It's not required.
But if you do check your antibodies after vaccination and you test positive for antibodies after vaccination, is there any way to determine whether these antibodies are vaccine induced or whether you've had a past infection?
No, there's no way to figure that out. You could have had antibodies after getting infected and the vaccine will just boost the levels. There's no way to figure that out.
Okay. What is the best way to gauge vaccine-induced immunity? Is there a test? Is there a way that one can understand how much protection you have against COVID after you've been vaccinated?
Well, natural infection gives you enough protection, but the people who've had infection have enough antibodies, and then when they get a booster, they're the most protected, I would say. But whether you've had natural infection or whether you've been vaccinated twice, I mean, the bottom line is that you have enough protection and it protects you from severe disease and death. And that's what we're worried about. We're not worried about whether you get infected or not. You might still get infected after vaccination, but you'll not land up in the hospital and you won't have severe disease. And that's what these vaccines make sure that they do.
Well, and that's really the bottom line of it, and which is reason enough for everyone to go out and get vaccinated. Thanks very much, Dr. Tikku, for joining us.
Thank you.